You started Ozempic, and now you can't eat. Not just not hungry, actually nauseous. Even the smell of food can set it off. Here's what most people don't know. The nausea isn't random, it follows a pattern. And there are 3 specific things you can do to make it better. One quick safety note before we continue. If you're experiencing severe abdominal pain, repeated vomiting, dehydration, or fever, get medical care. Those aren't routine side effects. This is general education, not medical advice. If you're experiencing symptoms, please consult your own doctor. Ozempic, semaglutide, belongs to a class called GLP-1 receptor agonists. This medication mimics a hormone your gut naturally releases after you eat. That hormone does 2 things. It signals your brain that you're full, and it slows down how quickly food moves out of your stomach, what doctors call gastric emptying. Ozempic does the same, but at a much higher intensity than your body normally produces on its own. So what does that mean in practice? Your stomach empties more slowly, food stays in longer, you feel full faster, and for many people, especially in the early weeks of treatment, that translates directly to nausea. This isn't a malfunction. It's the medication doing exactly what it was designed to do. Your stomach is receiving a signal it hasn't experienced at this level before, and it takes time to adjust. In some trials, roughly 15 to 20% of people on semaglutide reported nausea, most commonly in the first 4 to 8 weeks, particularly around the time of dose increases. Estimates vary by study design and dose schedule. For most people, it does improve as the body adapts. But it gets better eventually isn't useful advice when you're feeling sick right now. I'm Dr. Kim, a licensed physician. I've put together 3 specific adjustments that target exactly what's causing the nausea and what you can actually do about it right now. Rule number 1, eat smaller portions and eat more slowly than you think you need to. Most people underestimate how much the medication has changed the way their stomach works. Before Ozempic, your stomach emptied at a certain pace. On Ozempic, that pace has slowed considerably. If you're still eating the same portion sizes you ate before starting the medication, you're filling a slower draining container. The food sits there longer. Pressure builds. And that pressure is one of the primary triggers for nausea. In some studies, reducing meal size, even by around 30%, was associated with less nausea in people using GLP-1 medications. The key insight: you don't need to eat less overall. You just need to spread it out. Smaller meals, eaten more frequently throughout the day, give your stomach the time it now needs to process each one before the next arrives. Eating speed matters just as much. Chewing thoroughly, putting your fork down between bites, and pausing mid-meal. On Ozempic, these aren't just polite habits. They're functional strategies for keeping pressure from building in a stomach that is already working more slowly than it used to. And stop at the first signal of fullness, not the second, not when the plate is empty. On Ozempic, fullness arrives earlier than it used to. Pushing past that signal is one of the more common ways to end up nauseous an hour later. Now the part people don't expect. Most people don't figure out which foods are the problem until they've already paid the price. Rule number 2, avoid high-fat, spicy, and very sweet foods. Fat naturally slows stomach emptying on its own, independently of Ozempic. When you combine a high-fat meal with a medication that is already slowing things down, you're stacking 2 brakes at the same time. The food stays in your stomach for an extended period, pressure builds, and what might have been mild discomfort can become genuine nausea. In some studies on the medications, patients who reported more severe nausea were more likely to have eaten high-fat or high-calorie meals in the hours before symptoms peaked. Spicy foods work differently. They can directly irritate the lining of the stomach. When your stomach is already under pressure from slowed emptying, that irritation can meaningfully amplify the nausea signal. Very sweet foods, particularly those high in refined sugar, tend to draw water into the gut rapidly, adding to the bloating and fullness that Ozempic already creates. What tends to work better during the adjustment period? Plain crackers, toast, white rice, low-fat protein like chicken or white fish, and cooked vegetables rather than raw. Not the most exciting menu, but stable and easy for a slowed stomach to handle. This doesn't have to be permanent. Most people find they can gradually reintroduce a wider variety of foods as the nausea settles over the first few weeks at a stable dose. Think of this phase as temporarily switching to a gentler gear while your body adapts. Rule number 3. Work with your doctor on injection timing. Ozempic is a once-weekly injection, and nausea tends to peak in the 24 to 72 hours after each dose. That's the window when semaglutide levels are rising most rapidly in your system. What this means practically is that you have some control over when that nausea window falls. This is something worth discussing with your doctor. In practice, many people find that shifting to a day before lower demand days, like a Friday evening before the weekend, gives them more flexibility to rest and manage symptoms without disrupting work or other obligations. Many prescribers also discuss evening injections with their patients. Research suggests that injecting at night, just before sleep, may allow people to sleep through the sharpest part of the nausea curve. You may still feel some residual effects the next morning, but for many people, the peak has already passed by the time they wake up. One more consideration worth discussing with your doctor: injection timing relative to meals. The combination of a large meal and rapidly rising medication levels can, for some people, compound nausea noticeably. A lighter meal around injection time is something many clinicians mention as a practical option. It's also worth knowing that nausea on Ozempic often follows a predictable weekly rhythm. Some people notice they can almost anticipate which day will be harder. That predictability is actually useful. It means you can plan around it. Keep that day lighter, lower the demands on yourself, and let the medication do its job. And if nausea remains difficult to manage despite these adjustments, that conversation with your doctor is worth having. Staying at the current dose longer before moving up is a legitimate clinical strategy that many prescribers use to improve tolerability. Let's bring this together. Ozempic nausea is real, it's common, and for most people it does improve over time, but you don't have to simply wait it out. Rule 1. Eat smaller, eat more slowly. Your stomach's pace has changed, your habits need to match it. Rule 2. Avoid high-fat, spicy, and very sweet foods. These are the biggest offenders during the adjustment period. Keep meals bland and light until the nausea settles. Rule 3. Work with your doctor on injection timing. Talk to them about injection day, consider evening timing, and keep things light around your dose. On Ozempic, nausea is often a timing and volume problem, not a mystery. If you found this useful, subscribe. There's more coming on GLP-1 medications, what the research actually says, and what doctors see in practice. This is not medical advice. Consult your doctor.